centrifuge, all this craziness, stacking my own porcelain. And then by my third year, I was milling titanium frameworks because technology just started to change, and I happened to be at a great time to be, in my residency learning. I was able to kind of get that bug for innovation and change and technology, and really built my entire practice around this. And so I was in private practice for over 10 years. I had a multi-doctor, multi-location, pure play prosthodontic practice where we placed and restored thousands of implants every year. Did a lot of full arch, was a very early adopter of concepts like the all-on-4. I got to do a lot of cool things in the industry, did a lot of publishing. I was the first prosthodontist in the world to have a Yomi robot for robotic implant placement. I started lecturing for major companies in the industry when I was really young. And by the time I was, into my practice career, I spent half my life in private practice, half my life lecturing somewhere around the world on every main stage symposium there is out there. I did a lot of publishing and started my own institute. And all of this is not to just tell you who I am, look at me. It's really just to show you the level of commitment that our organization has to each and every one of you. Because for the last 6+ years now, my entire focus has been on how can I support doctors such as yourselves find success and grow to be able to practice the kind of dentistry that I think is absolutely the best dentistry in the world for tooth replacement, which is dental implant therapy. How do you grow and develop your skills? How do you find success in this profession, and do it in fun ways with technology and innovation and all these things? And so, as you can imagine, it was a big investment when I started to help lead our implant initiative back, many years ago. And, we found a lot of success along the way. And so what I wanted to do is spend a little bit of time talking to you about why these concepts matter. Like, what are we trying to really accomplish when it comes to the patients we serve and the people we are charged to heal? And then I'll open it up to Q&A, and, we can just talk. You can obviously type it in the chat. I think Maggie's going to help curate some of that. But for me, it's really about who we are, what's our kind of mission or purpose when it comes to helping people with tooth replacement. And, I think why I feel like we've got probably one of the best implant, I think, experiences for doctors and patients in the world today. Okay, so I'll just talk clinically for a little bit here, and then we can open it up to Q&A. And when you think about clinical, when you think about what we're trying to accomplish, in many respects, it just comes down to what your goal is. And this has been my goal for over 15 years of being in dentistry as a prosthodontist. And that goal is to be able to give people back teeth. But gone are the days of us looking at things in black and white. There was a time when I started when we looked at things in black and white, when we said comments like, unfortunately, your tooth needs to come out, or you're missing a tooth. You've got a big black space or black hole, and we're going to fill that with a bunch of white. We're not exactly sure what it's going to look like, but hey, it's the best we can do. There was a time in implant dentistry that's how we communicated to patients, because it was true. We'd put in an implant, we'd, put a tooth on top of it or teeth on top of it, and, whatever it looked like was the best that we had at the time. But gone are the days of us looking at things in black and white. And today we look in color. We look at black, white, and pink, or hard and soft tissues. And we really talk about how can we recreate nature or the illusion of nature. My goal today is this, that if you look at a smile, you can't tell which tooth or which teeth are the implants, right? And my ultimate goal is a happy, healthy patient, one who smiles and loves their life, and you say smile and their whole face lights up, and they can go to a restaurant and they can order off the menu at what they want to eat, and they can have a job and socially interact and find a someone to share their life with and have meaningful relationships and be happy and never worry about their dental health affecting that. That's my goal today. Now, you guys are in dental school or a residency program. So you look at this picture and you're like, dear God, there is a chip on the incisal edge of tooth number 9. There is a millimeter of recession on the bicuspids. There's a rotation in the canine, right? There's asymmetries in the free gingival margin. Like, you guys will look at this and you'll pick this smile apart because you guys are looking at a textbook smile. That's what you're taught. But the reality is this patient is happy and healthy. And if every one of our patients look like this, we'd be doing prophy checks all day. The real question is, how do we get to this goal? How do we accomplish this vision when a patient presents looking like this? So this was a patient who came into my practice over 10, 15 years ago. It's a patient who chief comment was, I had implants placed. I'm ready to go. I want my teeth, please. All right, congenitally missing lateral incisors, had been in a flipper all through her teen years. She's getting ready to go to college. She finally got the implants placed, right? She's ready to go. And I won't bore you with the details of how we went about making impressions and doing the things we needed to do and trying to site develop or provisionalize to create an emergence profile. We're in the aesthetic zone. We're trying to recreate nature or the illusion of nature. And this was the end outcome. Now, how many of you think that if you went to my website back when I was practicing, right, drsunnyperwalla.com, how many of you think that this would have been the first picture you saw when you went to my website? Anyone? Raise your hand if you think it was the first picture. Anybody?
You can add it to the chat.
Okay, one brave soul. I love it. Yeah, you're right. This wasn't anywhere on my website. Why? Because it doesn't look right. Right? It looks funny. It looks off. Why? Why? Because, not to bore you with the details, but the implants were placed too shallow. And because the implants were placed too shallow, all I could do was make implant restorations that had short clinical crowns. And mind you, these implants are perfectly integrated. They are well-made crowns, match the color, translucency, shade, hue, all the chroma, the value, all the things that we talk about, right? But in my world, when we talk about recreating nature, what we're really saying is we want to recreate teeth that look like teeth, feel like teeth, and function like teeth. And if that's my litmus test for success, right, of therapy, teeth that look like teeth, feel like teeth, and function like teeth, this is a therapeutic failure on day one because these don't look like teeth should. Even though the implants are perfectly integrated, even though the crowns are well made, it's a failure of therapy on day one. And I'll take it a step further. In the world we live in today, in my opinion, this is iatrogenic or operator error. Totally avoidable today. Because today we have the power of digital technology. We have the power to ensure that everything we do can lead to a predictable outcome. And I want you to heed my words very carefully. I'm not saying a perfect outcome, but a predictable outcome. If I identify on day one that that is the aesthetic outcome I'm going to get, and there's no way around it without doing complex procedures, adjunctive bone grafting, soft tissue grafting, orthognathics, whatever, it doesn't matter. But if I identify that on day one, I talk to the patient, explain it to them, they opt to live with a compromised outcome, then that's still a successful therapy because we're able to manage the expectations of the patient. We're able to deliver an outcome that's predictable. It's when it's not predictable or when we promise them that vision of health and we can't deliver on it, that's when we run into trouble. And that's where digital technology allows us to create that level of predictability. Okay. And it's so important because technology is changing dentistry, changing everything we do in this profession. But there's no facet of dentistry that is more impacted by technological innovation than implant dentistry. It has pervaded everything we do in implants. It has accelerated the rate of change so that what we do today is not what we did yesterday. What we do tomorrow isn't going to be what we do today. And it's exciting, but it's also, in my opinion, it's also a little bit daunting when you're early in your career to be able to understand how you're going to leverage technology. What technology are you going to use? How are you going to use it? All of these questions start to arise. But if we're going to go digital, then the first stop in our digital experience is data acquisition and diagnostics. And today we've got wonderful mechanisms to be able to acquire data digitally upfront, get into the digital world, and then make very sophisticated decisions on diagnostics based on all of our fundamental knowledge around implant dentistry and where teeth should go and everything else. So as you can see here, we're able to do some sophisticated data analytics around smile design. We're able to not only understand where the existing teeth are, where a proposed tooth position should be, but we're able to go and visualize that from a digital design perspective, be able to create the ability for a patient to see what their before and after can be, help motivate them to be able to do this, even execute a mock-up if we need to intraorally. But all of this is to be able to show the patient what a before and after could be and what's the potential for a patient. And that's powerful. That's motivating. And it also allows us to develop a predictable plan. And when we do that, we're able to then execute on that plan. Go a step further, take the diagnostics and go into actually using the data, right? In this case, designing for this patient removable prosthetics, where we're able to very clearly layer in multiple layers of information like the intraoral scan, like a CBCT for where the hard bony architecture is and dentition is, and then able to make sophisticated, predictable decisions about where we want to go, how we're going to execute on that plan, and then ultimately take it to the mouth to create unbelievable outcomes for our patients. Okay. This to me is a great example of how we should be practicing all of dentistry today, but especially implant dentistry. Making good fundamental decisions about the optimal tooth position in the digital world, then building a plan that helps us understand where the optimal position of the implant should be to create the foundation that we're striving for, and then ultimately executing on that plan through guidance and a lot of other clinical applications to be able to ensure that what we plan is what we execute. And we see this across all modalities of implant dentistry. Here's a case where we're going to create a combination of full mouth rehabilitation. We're going to start with the maxillary arch. We're going to do a combination of natural tooth restorations along with implant prosthetics. The patient already had existing implants in the upper posterior area. We go through the same recipe. We're going to create an acquisition of data digitally between the intraoral scan, CBCT, in this case, diagnostic photography as well. We're going to go into smile design software. We're able to then execute and diagnose where the optimal tooth position should be. right? Creating the perfect smile for this patient, having latitude to modify as needed. Then we're able to, in this case, mock up the patient, gain that motivation, be able to predictably say, hey, this is where we can go. Or by the same token, if we identify red flags, be able to say, hey, we can't get here unless we do A, B, C, D, and E, right? But able to really create the right plan, get the patient buy-in, and then go execute. And here you can see we're going to now digitize through the execution phase. What you're looking at is reference scans that we've created of the provisional that the patient's been wearing based on our initial smile design. The patient has been test driving the aesthetics, the phonetics, the form, the function. We're able to then copy this into the digital world, layer lots of different data sets together, whether it's where the existing provisionals are, where the opposing dentition is, the occlusion, and then also create in that same data set more information like where's the preparation, right? Where are the preparations with respect to all of our diagnostic information? And you can see here now we're scanning both implants and natural tooth restorations all in the same scans, layered together with where the initial blueprint was or the provisional, the prototype based on where the original smile design was. And then from there, it becomes very easy to execute from a manufacturing standpoint. Go into CAD/CAM, either mill your restorations. Now we have a lot of 3D printed applications that we're utilizing as well. So whether you're milling, whether you're printing, you're able to deliver predictable manufactured prosthetics, following through this whole digital ecosystem to get optimal outcomes for patients that are predictable, that are easy to deliver on, or easy to execute. So predictable, in fact, that young prosthodontists such as this guy over here might be bold enough to do a case like this on his mother-in-law, which is what you see here. This happens to be my mother-in-law. I happen to actually do this whole case on her. It's a lot of trust, by the way. Yeah, and combination of natural tooth restorations, combination of implant restorations, get a good predictable outcome that has allowed us to have a very great relationship for the last many, many, many years. So all good on that front. And we have it, look, we have it for removable prosthetics and overdentures, removable fixed applications like full arch, all on 4, all on X. We've got it for natural tooth combination with implant dentistry. We have it for even the hardest cases in our lexicon, which in this case for me is always going to be replacing a single maxillary central incisor, right? It's much easier to do an all on 4 than it is a single central. Much easier to do both centrals, 8 and 9, than it is to just do one. But here's a case, trauma, patient comes in, was playing basketball, it's a 19-year-old kid. He got elbowed in the face, and 4 hours later, he ended up in my chair to try and help him out. We followed the same rubric that we've been talking about. In this case, we extracted, we grafted, we tried to preserve everything we possibly could because it was trauma. We didn't want to do something too soon, like place an immediate implant. We wanted things to heal, make sure no other adjacent teeth were involved, etc. And then we went after the healing process, digitized the information, followed the same recipe. We understand where the optimal tooth position is. Based on the optimal tooth position, we can diagnose exactly where the optimal implant position should be, execute on that plan, and ultimately be able to deliver a predictable restoration for the patient. Okay. That's the power of digital technology today in implant dentistry. That's how all of our clinicians across our nearly 1,200 locations practice dentistry today, because they have the knowledge, the skills, the tools. They have everything, okay? They have all of this because of the predictable process that we've created to support these doctors, these clinicians, and the teams around them. And that's really what my role is today. That's what our role as an organization is today, is to support all of you to be able to practice dentistry and treat the patients you serve with the most, I think, contemporary state-of-the-art ways and deliver the most optimal care to patients. Okay. And it comes down to creating that predictable process, leveraging technology. But just to give you a brief glimpse of where we are today, how I can say that all of our clinicians across, almost 1,200 locations are able to practice this way, why we are the number one provider of implant therapy. As an organization, we're the number one provider of implants in the world today. Okay. We are the largest branded dental support organization in the world today. And we have, I think, the most predictable process for doctors to be able to execute implant dentistry at this level in this manner today in the world. But how do we get there? Well, it is a process. Okay. And it all starts with all of you and your own personal growth and development, your learning journey. Because let's be honest, the most sophisticated education in dental implant therapy today does not come in aggregate from dental school or from residency. There's just too much to cover. There's too much to learn when you're in your initial years of education, right? That there's not enough time to learn it all. So when you go out into the world and you start your career, really, it's a continuation of the learning you started in dental school. The learning never stops. So the question is, how are you going to learn all of this? Who's going to teach you? How are you going to take it? Are you going to take a course? Which course are you going to take? How are you going to know if the education you're getting is good or not? Right? These are questions that I think all of you will face in your careers. And what I can say is when you come and become a part of an organization like ours, we take the responsibility of ensuring that the learning you get is the best in the world, that the learning you get is impactful, that the learning and growth and development you have means you can treat patients in better ways. Okay. And it all starts with your learning journey as a clinician, right? And we're very thoughtful about this. We spent years building our learning journeys, right? Being able to create what we call our implant continuum, which is made up of multiple parts, starts with the basic building blocks or theory of implantology. Part 1 and 2 is didactic online self-paced learning based on ITI content, which if you're not familiar, ITI is the International Team of Implantology, is probably one of the oldest and most robust bodies of evidence-based literature to support implantology in the world today. We follow that kind of self-paced online learning with didactic in-person experiences, being able to help you interact with world-leading experts to be able to deliver an educational experience that allows you to grow from a theoretical standpoint with your implant knowledge and skills. We have teams that will help you through that process. And then when you're ready, when you feel like you're ready to take that next step in learning implants, we have live patient experiences where you can actually do things like learn how to place implants on live patients, right? Be able to train in the most sophisticated ways so you get maximum ability to learn and grow. Your best education in dental school, in my opinion, comes from your clinical work, being able to actually go and cut a crown or make a denture on a patient, not on a typodont. So we follow the same rubric when we create our learning journeys, being able to find a recipe that gives you the ability to learn in the mouth, right? But then we also want to make sure you're finding success. And so we create the ability to track your performance and make sure you're doing things like diagnosing and treatment planning implants, restoring implants, getting surgical proficiency, being able to understand that there's so much more that goes to placing an implant than just drilling an osteotomy and putting in a screw. There's managing surgery. Do you do bone reduction? Do you do bone grafting? Right? How do you do all of these things? Are you using things like CBCT and imaging? Right? Can you actually manage a schedule and be productive so that it doesn't take you 8 hours to place a single implant? Because if it takes you 8 hours to place a single implant and you can only see one patient a day, that's not a really good recipe for success. Okay. And like I said, when you're ready, we're ready. And we'll bring you in and invite you to come to our Oral Care Center for Excellence, which I think is the preeminent learning facility outside of a university in the world today to be able to deliver an educational experience with live patient care. It's a state-of-the-art 25,000 square foot facility here in the heart of Chicago. We have 17 state-of-the-art operatories. We're fully digital lab, all digital workflow, diagnostics, scanning, printing. We have world-leading experts who come in as faculty. It's an unbelievable resource with best-in-class partnerships that allow us to deliver on this, right? So you've heard a lot about why this is important, to be able to create this model of care so that you can go out and actually give your patients the best solutions possible. And you've heard about how we create an educational experience that allows you to learn and develop your skills, grow. But one of the things that I think a lot of people in the industry don't talk about is that the learning cannot stop. It can't be static and stop when you're done with the course. Right? Static educational experiences only get you so far. You have to layer in ongoing support. Because guess what? You can go to any course in the world. You can learn how to place an implant. You can learn the best practices from lots of people out there. But who's going to help you do it on Tuesday morning at 10 a.m.? Who's going to train your teams? Who's going to make sure that you're running your schedule efficiently and setting yourself up so you're not stressed the first time you're placing an implant in your office? Who's going to make sure that you've got all the right componentry and instrumentation to be able to effectively do this? And that's where support comes into play. And support is so critical. And we've got an unbelievable resource when it comes to our ongoing implant support. We have teams around this. And I got to update the slide because there's like, another 10 names on this list already, right? And then we have this unbelievable network of both clinical and operational support that allows us to deliver on two facets that I think are so important to your day-to-day ability to deliver care. One, do you have the clinical support you need as a doctor to be able to go out and execute the dentistry that we're talking about? And two, do you have the ongoing operational support to make it practical and easy to do that dentistry, to support your teams, to make sure that everything in the office is running the way it should be so that you can focus and maximize your opportunity to deliver clinical excellence? And those things come hand in hand. Specifically for implants, we've got this robust support mechanism. We have online resources. We have in-person, over-the-shoulder resources. We have boots on the ground who visit your offices to make sure you're finding success. And then the last thing that we do really well is we create best-in-class partnerships. So as an organization, we are the largest support organization in the world. We support all of you as you deliver clinical dentistry. But you are the clinician. You make all clinical decisions. We do not dictate anything you do when it comes to how you deliver clinical care. However, we create really best-in-class partnerships. We partner with the most leading companies when it comes to facets of dentistry that allow you to deliver best-in-class products and services to the patients you treat or you care for. So when it comes to things like our implant, we have a great partnership with Straumann, and we use the Straumann BLX implant. It's the #1 implant in the world. We are the largest #1 provider of BLX implants in the world today. And 98% of every implant placed in our organization today is a Straumann BLX. Not because it has to be a Straumann. If you want to do an ABC implant, I'll support you in that. But I've got about 35 different reasons why I think the Straumann BLX implant is the right choice to be able to affect a good outcome for patients. Same with our 3D printing partners. We're partnered with SprintRay. We've got Trios from 3Shape for our intraoral scanner. We've got all these great partnerships to be able to give you the advantage of practicing not just great implant dentistry, but doing it in the most innovative ways possible. We help co-develop and shape the industry today, creating innovations with all of our partners, from the implant manufacturers to the 3D printing partnership with SprintRay, to the materials that are on the industry, out in the industry today for 3D printing, to some of the AI innovations that are out there today. We've helped co-develop and really set the tone for the industry. So with that, I will stop. I will open it up for Q&A. Please feel free to ask away, and hopefully we can answer and demystify all of your questions. So thank you, guys.
Thank you, doctor. We have one question so far. How many implants do the students place on average, and the cost?
Yeah, look,
So
I think that's a great question. So we have a whole implant continuum, right? When it comes to just let's call it the level 1 surgical training, right? You're ready to learn how to place implants. That first course, and we have advanced courses. We've got courses that, teach you how to do implants with bone grafting and restorative implant trainings. And we've got, zygoma implant placement for oral surgeons. And we've got, other courses on various aspects of implant dentistry. But just let's take that, hey, I need to learn how to place an implant type of course. Typically, you're looking at something along the lines of a 3-day course. You'll place somewhere around 15 implants, right? You'll do it in a very curated experience where you start with single tooth applications. You work your way to partially edentulous. You get to full arch overdenture. Okay, you'll do it in an experience where you're placing both freehand first, and then you learn guided at the same time afterwards, so you get the benefit of understanding and having good clinical sound knowledge and experience from an analog freehand perspective. And then you learn how to use a guide so that you can leverage technology. So it's really curated experience. You'll place about 15 implants. Now, a course like that on the outside world, if you're just a solo practice and you say, hey, I want to learn how to place implants, a course like that could cost, I don't know, somewhere between, on average, $18,000 to $20,000, depending on, where in the world you go to get that experience. And you probably won't place 15 implants, but still cost you $18,000 to $20,000. Our live patient experiences, a lot of our implant continuum is free, right? You do a lot of the parts of the implant continuum. There's no cost to you as a clinician. Some of our live patient courses are, there is a tuition involved, because guess what? We're running a full-time clinic. Our Oral Care Center for Excellence is a full-time clinic. We deliver comprehensive care to the people we serve. And by the way, we do it at no charge. It's also one of our arms of our charitable initiatives. So we do free care at the Oral Care Center for Excellence. But it is a comprehensive clinic that has full-time prosthodontists, hygienists, assistants, the whole 9 yards. And so there are some investments there. And so there is a tuition involved for our live patient courses. The average initial experience that I told you would be like $18,000 to $20,000 is, in our world today, is like $10,000, $11,000. Okay, if you're part of the organization. So already significant savings. On top of that, we have these unbelievable programs where if you are in your office and you're practicing, there might be some programs where we apply discounts to the tuition that you make. So it might only cost you $5,000. On top of that, we've got these great programs where you can get your entire tuition reimbursed. And so we have almost, I believe it's close to 40% of every doctor that goes through our initial course gets it for free. So we really try our best to break down every barrier so that you can get the education you need to grow and develop with as little investment as possible to you as a clinician. So hope that answers your question.
Yeah, good question here, because I know we have students and residents not just practicing dentists on here. What is the average time it takes for a new grad Aspen dentist to start placing implants?
Sure. I think, I get that question every time we do anything like this. The answer is it depends, and it depends on you, not me. In other words, we're ready. We're running courses every month. We sometimes every 2 weeks we're running courses. We're always running courses. For me, it's not so much about are we ready? It's really a question of when are you ready? And what I mean by that is you're going to graduate or you've been in the profession for a while. Everybody has kind of a unique experience level already, or they've, got different different abilities coming out of dental school. And so for some people, if they've got experience, they could start placing implants on day one. They don't need to take a course. For other people that are, have some experience but have never placed implants, it can be as little as 3 months. We've had people start placing implants within their first couple of months of being part of our organization. Other people say, hey, I don't even know what titanium looks like. Right. And for those, and that might be a little bit slower, it could be 6 months, 9 months. Typically we'd say like on average, I'd say it could be somewhere between 6 months to 12 months, depending on you. Some is shorter than that. Some might be, the full 12 months, but it really comes down to where you are and when you're ready. And I'll give you a good reason. I could take all of you on the call and say, tomorrow I'm going to teach you to place all on fours. Okay. You come join Aspen, the next day you come take a course. Live patient will teach you how to place all on fours. If I did that, 90% of you would never place an implant for like the next 12 months at least, because you're not ready. You're not prepared. So what was good? What good was it to teach you or put you through a course, right? What I need is for you to be ready to absorb the knowledge, have the confidence to go back out, have the support to go back out, to actually go out and change how you treat the patients you serve. And if that's the case, then you need to be ready for that. So if you're not really that experienced at taking out teeth, right, opening a big flap, visualizing the mental frame and reducing bone, grafting, membranes, you come to an implant course, you might spend all of your time just trying to figure out how to shuck the teeth and open a flap, right? And you don't really get a lot out of the implant side of it. And that's an experience that's very common when you're just, in practice and you go out and you try to take a course. It's such a variable experience. You're not really ready for it. You don't really adopt it. Instead, we have a recipe where we just make sure you're ready to maximize the impact of that learning. And if you do, guess what? You have the confidence to go back out and actually change how you practice dentistry. And the results are pretty clear cut for us. Does anyone know what the average number of implants placed by a GP globally is? If you're a GP and you're, a total solution provider, you both place and restore implants, solo location, right? The average GP places less than 50 implants a year. The average globally, okay? Less than 50 implants a year. 90% of all GPs placing implants will never place 100 implants a year. On average, after 10 to 12 months post one of our courses, most of our doctors are placing over 100 implants a year. They're in the top 10% of GP placing implantologists in the world because we make sure you're ready to learn when you come. You get value, you get the confidence, and you can go out and change how you do dentistry. So that's why it's not a clear cut, oh, it's at month 1 or month 6 or month 9. It's always about when you're ready, we're ready to do this with you. Okay, I hope that answers your question.
Great answer. How popular are implant-supported dentures today? I feel like I hear mixed opinions about them.
Yeah, I would tell you this, they're very popular. We do a whole lot of them. Our patients say yes, a whole lot to implant-supported dentures. The real question is, are you diagnosing and treatment planning and then making the right decision on what that patient needs to make the change that they're looking for in their life? All right. And so just real briefly, like if you diagnose that a patient has an issue with stability or retention, putting in 2 implants are going to get a great outcome. right? Because a tissue-supported implant retained prosthesis will work very well for them. But if you diagnose that they have a lack of support, they really need full implant support, then 2 implants is not going to impact them well. And you need 4 implants. You need to have a good distribution, a good AP spread, so you can have full implant support, right? So it's a combination of, I think, being able to understand, diagnose, and treatment plan what the patient needs, and then going out and executing. And if you do that well, then the outcomes are that patients are most satisfied with implant prosthetics, right? Especially for the terminal dentition patient. So implant overdentures or implant fixed, it doesn't really matter. All on 4, a denture that snaps on and off of 4 implants, they can be exactly the same in their engineering, their design, how force is distributed. One is fixed, one is removable, but they function exactly the same, and patient satisfaction can be exactly the same. So at the end of the day, I think, yes, we have tremendously good results, but we teach you how to diagnose, how to make sure that you're executing to meet the patient's needs when you're doing implant overdentures.
Great segue to this question. As an organization, how is this balanced with the busy schedule of a general dentist? And do I get the choice to focus on implants, for example, for like 70% of the schedule? Or
Yeah.
how is that handled?
Yeah. Here's what I tell you. It's like kind of an ironic question. Like what you're basically telling me is you're either a busy general dentist or you're an implant dentist, right? An implantologist. I see the world differently. I think a busy general dentist is an implantologist. And so I don't know how you can practice general dentistry today without implant therapy, whether it's you're just diagnosing, treatment planning, and restoring, or you get to a level where you're actually placing, you are an implantologist. And your care for tooth replacement involves implants. To me, that's a general dentist. So I don't see how, and that's our philosophy. I don't see how you can say, oh, I'm going to be a busy general dentist, or I could be an implantologist. No, that's one and the same to me. Okay. And our busiest general dentists are our busiest implantologists. Okay. And then the second part of your question is, can you focus on implants as whatever percentage you want of the kind of dentistry you do? And I think that the answer is it just depends on you, right? If you're going out and you're talking to every single patient about implants and you're passionate about it and you're confident and you have a good experience to build rapport and you show value to people, people will say yes. And if people say yes, guess what? You'll do more implants, right? So it comes down to you, I think, right? If you focus on it and you're doing all the right things and you're bettering yourself and you're learning how to deliver this care and you're getting good outcomes and you're building your confidence and your team sees that and your team is more confident, your team talks about it and you talk about it and you present it. And all of a sudden what happens is you organically are creating an environment where your patients are going to say yes to implant therapy. And when that happens, you do more implants. So that all depends on you. Again, we don't dictate clinical care. We don't have quotas. We don't have any of this nonsense, right? So at the end of the day, if you are a believer that implants are the best solution for your patient in terms of tooth replacement, and you're driven to be able to grow yourself and your teams and be able to deliver on that promise to patients, you can do 100%. You can only do implants, right? So that's how I look at it.
Great answer. Is digital planning guided placement also included in the course?
Yeah. Yep, 100%. So every participant that comes through our course is going to learn how to place implants. First, analog, because you have to understand how to do things from a basic clinical knowledge and experience level without the technology, right? And then you can layer in technology to make your job better, faster, more predictable, take less time, less money, make it more affordable. And so we teach both. So you'll learn how to do something freehand, then you'll learn how to do it guided. Then you go back to your office, everybody has software. We have planning services that help design and plan every case. Every single guided case in our organization gets reviewed with somebody on my team, which are world-leading experts, right? And then we have printers in every office so that you can print your surgical guides. We have same real-time guided design services. So you can meet somebody at 8 in the morning, say, hey, you need an implant, go fill these scripts, come back in 2 hours, and we're going to place your implant, and I'm going to do it in the most state-of-the-art way possible, right? So we have all of that built into our implant experience today.
Excellent. What type of attachments do you use for implant over dentures?
Yeah,
And
that's a
asking that
great
all.
that's a great question. So we predominant again, we don't dictate clinical care, so you could use whatever attachment system you want. I have personally, in my experience, used everything under the sun. Things you guys haven't even heard of, like Sika attachments, ERAs, Bredents, O-rings, hater clips, you name the older clips, you name it, I've done them all. I'm an old soul in this body. I've done them all. But predominantly, we use the locator system from Zest as our abutment of choice. Obviously, it's the most ubiquitous system in the world. It's been around for over 25 years. High propensity that anyone can walk in from any place in the world and have a locator on top of their implant. We've been using it for years and years and years. We've got all of the offices are kitted for locators. We have great experience with it, a great partnership with Zest. We co-developed the angled locator that has come to market in the last year. It was co-developed by us with Zest. We are big proponents of it. We love the fact that you can go from a 2 implant locator overdenture now to all the way up to a fixed solution with locator fix, and really give patients the ability to upgrade their smile over time with minimal change or minimal effort. So there's a lot of reasons why we like our partnership with Zest. But again, it's up to you what system you'd want to use. Happy to always debate why I think the locator system is a really good system to use.
Excellent. We have a D3 that is really ready to learn implants. I just want to let you know that someone from my team will reach out to you because this is a great time for you to shadow in one of our offices.
Sure.
Our doctors love students coming in. You could do a half day, full day, and we can work that out with you. So we will reach out to you. And next question is, do all Aspen offices have the 3D sprint ray?
Yeah, we are actually in the midst of a huge rollout right now, but probably in the next 90, 100 days, every office will have a sprint ray printer in the office. We have almost every office has CBCT that's fully penetrated. Every office has at least one Trios, if not two Trioses. So we're fully digital across our entire ecosystem.
Excellent. Here's a good one. When choosing between pilot drill guide and a fully guided surgical guide, how do you balance the trade-off between surgical flexibility and precision,
Yeah, listen,
especially in cases with limited inner arch space?
sure. I'm a big proponent of guided therapy, but I need to explain to you what guidance means to me. Guidance to me does not mean flapless, static resin guide, just drill, put the implant in. Okay. I have had the good fortune of being in a guided world for a very long time. I did my first guided case back in 2006, almost 20 years ago. I uh, I am also a big proponent of the word guidance, but guidance to me does not mean that flapless procedure. Guidance to me means you diagnose and treatment plan in 3 dimensions in software. You make really good, sophisticated, educated decisions about what and where implants should go. And then somehow, some way you execute to plan. Okay, it could be a pilot only drill.
Oh,
It could be a
doctor's
fully guided
frozen.
drill. It could be camera-based navigation. It could be robotics. We have offices in our network that use dynamic navigation. We have offices in our network that use robotic assisted implant placement. We have, obviously, all of our offices have printers for static surgical guides. It could be pilot, they could be fully guided. You could be opening a flap, you may not, right? The reality is you have to make good decisions and then execute to that plan. And that to me is guidance. So I believe in guidance 100% of the time. Now, whether it's pilot only, whether it's fully guided, to your question, I think for me, it depends on the case. It depends on what am I trying to accomplish. It depends on what my personal preferences are. There's so much that goes into that. And so I want everyone on the call to understand anytime someone says guided means this every single time, every single way for every single patient, to me, that's pigeonholing yourself into something that won't work 100% of the time because there's too much variability in the mouth. Okay. So instead, what guidance means to me, at least, and what I would say it should mean, it definitely means if you join our organization, is you're going to make really good decisions with the most state-of-the-art technology, with a high level of sophistication. And then somehow, some way, you're going to execute on that plan. And what that's going to allow you to do is get predictable outcomes, deliver better patient experiences along the way. Hope that answers your question.
Excellent. Do any of Aspen locations currently use Navident for dynamic navigation and
Yes.
implant placement?
I think I just answered that. We do have offices
Yeah.
that use, we don't use the Navident system. We use the X-Guide system. But again, that's just happenstance. You could, whatever system you want. If again, not to belabor the point, but like there's a lot of, I've done everything. I was the first prostodontist in the world to have robotic implant placement, fourth machine ever. One of these back here is the compendium from, I don't remember, 2019 or something. Cover of compendium, the first published peer-reviewed article on robotic assisted implant placement was mine. Okay. Big proponent of guidance, not just static, but also camera-based navigation and haptic-led feedback for robotics. However, I will tell you the gold standard that has 20 plus years of science behind it is printed static resin technology. And with the advent of chairside printers and real-time design services, it's really hard to beat the convenience of, in like an hour and a half, you're printing with a guide. It costs you a few bucks, right? And so at the end of the day, we're big proponents at scale of printed technology today. I think eventually, whether it's camera-based navigation, whether it's robotics, there'll be more sophisticated systems that become more practical to use daily, day in and day out. But today, I think the gold standard for a practical solution for guidance is still static resin technology.
Excellent. So most of our audience are students and residents that are eventually going to be making their career decisions. Doctor, do you have any words of advice for your audience when it comes to
Yeah.
their future?
Yeah, here's what I would tell you. I think that there's a few things that we do really, really well. We're not perfect by any means, like any organization, but there's some things I think that we do really well. And one of the things that I think we do really well is we really respect and we really understand that just like patients have choices, just like patients get to decide, do I like you? Dr. Maggie, are you the one that's going to help me? Right? And there's a lot of things that I have that can allow me to make that choice as a patient. A lot of things that help me decide who I want to help me and what differentiates people. But just as patients have those choices, what we are really good at understanding and knowing is that all of you have choices. All of you have a choice as to how you want your professional journey to be. All of you have choices of how you will practice dentistry, what environment you will do that in, and who you will choose to help you in that endeavor. And because of that, we really strive to make sure that we do everything we can to be the best choice for you. Right? And what I mean by that is we really, really make the investments to ensure that if you do join our organization, you will never have to leave our organization to grow and develop. You will never have to leave our organization to find the support you need, whether it's clinical, whether it's learning to be a better leader, a leader of teams, the business side of dentistry, how to manage an office, how to be successful financially in that endeavor, how to grow yourself clinically across any modality, right? Today, we're talking about implants. Could easily done this whole thing and talk to you about clear aligners, right? Or crown and bridge and veneers and cosmetics or digitally printed dentures. We're the largest provider of 3D printed dentures in the world today, right? So we realize and recognize that all of you have choices too, and we do our best to really provide, I think, an unparalleled experience when it comes to support and make it our life's work to give you really an ecosystem that, in my opinion, like you have to really find a good reason to leave us because we do so much to make it, I think, the right decision for all of you. So we respect that all of you guys have choices, and we hope that, one day you choose to be a part of our organization.
Wonderful. Very well said. Thank you, doctor.
Thank you.
Appreciate it. Getting a lot of thank yous coming in, so appreciate your time tonight. We will wrap it up, and my team will be in touch with all of you. So thank you and have a nice evening.
Thank you all. Take care.